The National Science Foundation Innovation Corps selected Ooney and the University of California, San Francisco Department of Surgery to participate in their 7-week intensive I-Corps training program. This experience allowed our team to explore the economic and societal benefits of where pre-surgical optimization may fit into the healthcare landscape. Today, I'm talking with my team and the founders of Ooney all about their inspiration, the plan, the challenges, and the road ahead. I'd like to start with Emily and Sean. Can you share what sparked the idea for Ooney and the Prehab Pal application? And what was the initial inspiration behind creating this platform?
Thanks, Tanya. Well, as a practicing surgeon, I would often have patients in clinic that were sort of older and frail, and these patients were at high risk for complications after surgery. So I really wanted to figure out a way to prepare patients for surgery. And that concept was prehabilitation, to optimize people's function before surgery, diet, exercise, home preparation, making things safer. So we had a pilot clinic where we developed all of these concepts, but we weren't able to scale up. Patients weren't able to travel. There was a time crunch before surgery. There wasn't a good financial model to support the providers that were providing the care. So that's where Sean came in.
Thanks, Emily. When we started working together, I had just come from leading app development for major health and wellness publishers. People looking to lose weight, to get stronger, were using our apps. And I realized that a lot of those similar approaches to usability, user experience, and content could be applied in the hospital setting to actually have a larger impact on patients preparing for surgery, particularly older adults. And we started to develop a program using the same principles I'd employed with product development at health and wellness companies. So really starting with the patients. So we worked using human-centered approaches, the same approaches I'd used for developing apps for people looking to get stronger and fitter, to help them really learn about optimizing themselves for surgery. Along with a health coach, patients are guided through the platform and have about 2 to 4 weeks to get themselves and their home prepared for surgery.
Great. Thank you so much. Now, Jenny, can you tell us some of the important factors you considered when designing the features of Prehab Pal?
Sure, Natanya. We looked to the literature, and I had just finished a postdoctoral fellowship in quality improvement and patient safety. This is about 10 years ago. And Emily and I looked at the literature, and coming out of Europe at the National Health Service in Canada were some data that suggested that patients who were having surgery for colorectal cancer, who underwent pre-optimization, actually had a higher likelihood of returning to baseline function. So we used the literature to kind of inform how we structured it. And we used what's called a trimodal approach. We looked at exercises that would optimize people in terms of their physical function. We looked at recommendations for diet, and particularly protein supplementation to diet. And then we looked to kind of mental health strategies such as anxiety reduction and calmness and meditation to kind of like prepare yourself mentally for going into the hospital. Around that, we wrapped around a couple of other things related to preparing for discharge. So getting people to think beyond the hospitalization. When they come home, is the home going to be a safe environment? Are there going to be fall risk there, like throw rugs and things like that? We might want to get rid of those things. Do they have somebody to take care of them? Do they have someone to help, with feeding and cooking and those type of things? And then finally, we talked about other things such as goals of care and advanced directives. So using from the literature and our experience, we built the in-person clinic first, and then we replicated that in a national trial of OptiSurge, and then finally moving to the web-based application that Sean built with Emily to develop Prehab Pal.
Thanks, Jenny. Now, during the program, one of the challenges for us was to get 100 interviews in several weeks of diverse stakeholders in the ecosystem to get all of the learnings possible. Through that, we've had many, many developments that are affecting how we see the future for Ooney. Emily, Could you share a little bit about what you see looking ahead and how you see the application evolving in the coming years?
Sure. Yeah, I think that one of the real problems with prehabilitation is that people have really been dancing around the data for years and looking for a way to get into this into patients' hands in a way that's very efficient. So what I'm really hoping is that we, with our data from our trial, show that patients can really engage with it and then they can really enhance their recovery, and that we can get this into the hands of patients all across the country.
Amazing. And as we know, there are many, many folks ready for surgery every single day, and none of them all adequately prepared, and outcomes are quite important for all. So this is really exciting stuff. Before we close, would love to take it back to you, Sean, and ask, how does being part of the National Science Foundation I-Corps, how did it influence the trajectory of Ooney for you?
There's really nothing that compares to actually speaking with customers and stakeholders. You really learn so much every time you have a conversation. And we've spoken to incredibly brilliant people, from patients, caregivers, surgeons, heads of quality, chief information officers. We've had this broad span, and every single conversation has just yielded some insight into what we're bringing to market. And it's been really inspiring, and nothing compares to it, truly. So it's been an incredible journey to do those 100 interviews over 7 weeks. It was daunting, absolutely, but every single conversation was worth it. So I encourage anyone who's considering participating in the I-Corps program to dive in and get it done. It's a mountain to climb, but you learn a lot.
Thank you so much, everyone. Very excited to share this news with the world and help folks come out on the other side of what could be a very scary time in the best way possible.